This is my MPH 5323 discussion board post number 4. The cohort study I decided to look at today was titled A Prospective Cohort Study of Endometriosis and Subsequent Risk of Infertility. The study aimed to look at the fertility outcomes of women under age 40 who were diagnosed with endometriosis via laparoscope versus women who had no other infertility risk factors. Infertility was defined as attempting to conceive for 12 months or more without a successful outcome. The group of women chosen to participate were 58,427 premenopausal women under age 40 from the years 1989 to 2005 who participated in the Nurses' Health Study 2. Each woman was followed up every 4 years post-assessment to see if they had successfully been able to conceive. The researchers looked at other factors related to infertility such as blocked tubes, lack of ovulation, hormonal imbalances, and spousal factor. These were excluded from the final analyses so that only endometriosis was considered. The study results showed that 83% of women diagnosed with endometriosis were able to conceive by age 40. However, 15% of those required medication to conceive and 2% required IVF. It was concluded that women suffering from endometriosis were 2 times as likely to struggle with infertility as those without. This case study looked at a woman who was incidentally found to have a rare form of endometriosis upon presentation to labor and delivery at 38 weeks pregnant due to contractions and bleeding. Upon C-section, she was found to have multiple large endometrial tumors, which account for 2% of all endometriosis cases. This was the cause of her contractions and bleeding. She had no prior complaints of endometriosis symptoms and had a regular start of her menses at age 12 and no other complaints. This case study highlights the importance of case studies that look at rare forms of a disease as they may not meet the textbook definition of the disease. The 2 studies that I evaluated in this discussion board post present strengths and weaknesses. For example, the cohort study of endometriosis and infertility was beneficial when evaluating the instances of infertility in a large population. This can be used to estimate prevalence in other populations because the sample size was so large. However, the cohort study does not look at unique circumstances that may affect an individual, such as nuanced definitions of endometriosis, like the deep infiltrating endometriosis in the case study. The case study is beneficial because it looks at more unique circumstances and forces researchers to consider alternate solutions to a problem. Like my case study showed, the endometriosis did not meet the clinical definition until it was surgically diagnosed, leading to potential worse health outcomes. However, case studies cannot be used to look at entire populations because they are very limiting and occur on a case-by-case basis. This is beneficial when looking at different clinical cases, however not so much when it comes to looking at an entire population. Here are my references that I used in this discussion board post.